In today's Improve You series, we dive deep into the topic of eyelid surgery. Did you know you can improve the look of your eyes thanks to the experts at the MedSpot IQ? It's there that plastic surgeon, Dr. Waldrop, specializes in eyelid surgery and can transform the look of your eyes. Our Stephanie Bainham has more.
Our Improve You series is all about helping you feel good and look good. And the first thing that you notice about people often when you see them are their eyes. And if you're not happy with your eyes or the look of them, there are procedures you can do right here in town, like eyelid surgery, to make you look and feel better. And there's no better place to go than the MedSpot IQ for that procedure. And we're joined by Dr. Campbell Waldrop here, who has all the details on eyelid surgery. Dr. Waldrop, thanks for having us today.
Thank you for coming.
And for those that might not know eyelid surgery, what does that exactly mean?
So what eyelid surgery means, there's upper eyelid surgery and there's lower eyelid surgery. And what it normally entails is removing some of the extra skin and fatty tissue that's around your eyes.
Yeah.
With the upper eyelid surgery, sometimes if it's drooping enough, the insurance will cover it. A rule of thumb is if the skin is kind of touching the eyelashes, that's oftentimes a situation where the insurance would cover it. Regardless, we're always happy to see people for it. The insurance will cover the visit, and if you qualify, they do cover the procedure. If they don't cover it, the cost of doing the upper eyelid surgery is about $3,200.
Right.
The lower eyelid surgery is the kind of the bags or the fatty pockets that people notice underneath the eyes. And I tell people the majority of all this is genetic, but the lower eyelid surgery is never covered by the insurance. It is cosmetic. And it's a surgery that we do here in our surgery center, which is here at IQ, and the cost of doing it's about $4,500, and that's the out-the-door price for the entire lower lid procedure.
And I feel like lower lids really bug some people. They look in the mirror, they look at pictures of themselves. It's quite noticeable, but it's easy to fix.
Yes, you're absolutely right. There are a lot of people who they feel like they really can't. They try to cover it up with makeup. They try to wear really dark glasses with big frames that will kind of hide it. But the reality is it really bugs people. And again, most of the time it's just genetics. Mom had it or dad had it. It's not anything specific that they've done, but it is something that we can fix, and we can fix it with surgery.
And so tell us about the surgery a little, before surgery and after, what people should expect.
Yeah, so the before surgery, you'd come in for a consultation to meet me, and I'd evaluate you and kind of go over what I think you could reasonably expect, whether or not I think you're a good candidate for it, whether there are other options that might fit you. We do a lot of Botox and fillers. So there are some situations where the consultation will help us know what the best step is. But assuming that surgery is your best step, I explain the procedure. We go over before and after pictures, and then we have you meet with one of our nurses to go over some health stuff. But the surgery's here. Sometimes everybody gets some sedation. Some people want to be completely out. Some people want to be a little bit more awake. And so we really tailor it to that person's interests and the procedure we're trying to achieve.
But it's not a painful surgery.
No, luckily it is not a painful surgery. You are bruised and swollen for, I tell people, 2 weeks of bruising and swelling. But almost everybody, just Tylenol, even after the surgery, would be really all they need. And in fact, sometimes people are kind of surprised, luckily, pleasantly, at how comfortable they feel.
Yeah. And you say this is even popular with men. And I think that's important to stress, because you don't look like you have work done when you finish with this procedure. You just look better.
For eyelid surgery, it's something very interesting. Men are very willing to do that one. There are other cosmetic procedures that they're not as interested in, but eyelids it fits their what they're willing to do. And one of the goals with how I do the eyelid surgery is for it to look natural. So it does look like them. It just looks like a fresher version, a little bit brighter look. So that's one of the things. That's why eyelid surgery is so popular, is because it doesn't give people a radical change. It gives them a nice freshening and a nice natural look.
But like you said, it takes an expert to make it look that way, and you are definitely that. You're an MD, plastic surgeon. You do this surgery all the time.
Yes, I do. I've been here. I'm the plastic surgeon here at IQ, and I've been here 14 years, and we do about 500 patients a year. So.
Wow.
And almost all of those are just eyelid surgery. So I really focus on it, I enjoy the procedure, and I really like what it gives the patients.
Well, remind folks where you're located and how best to get in touch so that they can and put this on their calendar and get it done.
The website's waldropmd.com. We have 3 IQ offices. We're here in the Fresno office. That's where the surgery is. It's on Sharon Avenue.
And we want to mention that the consultation is free.
Yes.
And you'll be talking about insurance and if that will cover it during that consultation.
Absolutely. And if it is a consultation for the insurance, that's something that goes through the insurance, but otherwise we're happy to see people and give them that initial evaluation for free.
And I know a lot of women want to know, how long till I can wear my makeup though?
Yes. It's about 2 weeks before you can wear your makeup on the incision eyelids. If it's the bottom eyelids, you can wear it right away.
Yeah.
But it's 2 weeks of kind of taking it easy. After 2 weeks, you can get back to all your normal things.
Yes, and definitely will do that and look even better. So thank you for all that you do for everyone here in town, and we want to encourage everybody to check out the MedSpot IQ for eyelid surgery. Thanks, doctor.
Thank you.
Wow, sign me up. That looks good. Pretty amazing work there, Dr. Waldrop. Stick around, everybody. We're back with more right after this.